segments of liver. Segments of liver are not well defined as in case of bronchopulmonary segments. Before studying segments of liver, we'll study lobes of liver. There are two kinds of lobes: anatomical lobe, physiological lobe. Anatomically, there are 4 lobes. Physiologically, there are 2 lobes. Anatomical lobes are right lobe, that is right side of here. This is anterior superior view. This is visceral view. Right lobe is right to the inferior vena cava and the gallbladder. This is all right anatomical lobe. And the left lobe is left to the ligamentum teres and ligamentum venosum. This is left lobe. And caudate lobe, that is between fossa of our gallbladder and the ligamentum teres, and the caudate lobe between groove for inferior vena cava and the ligamentum venosum. This is anatomical lobes. Physiologically, there are only 2 lobes: right lobe and the left lobe, separated by an imaginary line passing from inferior vena cava to the cystic notch of gallbladder. Segments are defined in physiological lobes. Physiologically, there are 2 lobes: right lobe and the left lobe. Right lobe is further divided into anterior and the posterior. Left lobe into medial and lateral. Again, anterior lobe is divided into superior and inferior, and the posterior lobe is divided into superior and inferior, and medial lobe is also divided into superior and inferior, and the lateral lobe is also divided into superior and inferior. Anterior, superior. This anterior, inferior. Posterior, superior. Posterior, inferior. Medial, superior. Medial, inferior. Lateral, superior. Lateral, inferior. There are 8 segments. The veins draining this hepatic segments are intersegmental, that is, one vein can drain from many segments. This is why this segments of liver is not well defined. And this clinical correlation of this is hepatectomy. Usually the one complete right or left lobe is removed during surgeries, as there are not well defined lobes in liver. Again, we'll revise. There are 2 kinds of lobes: anatomical lobe, physiological lobe. Segments are divided through the physiological lobes. Anatomically, there are 4 lobes: caudate, right lobe and the left lobe. Physiologically, there are 2 segments: right lobe and the left lobe. And segments are done through the physiological segments. That is, right lobe is further divided into anterior and posterior, left lobe, medial and lateral. And anterior is divided into superior and inferior. Posterior is divided into superior and inferior. Medial is also superior, inferior, lateral. Again, superior and inferior. There are totally 8 segments of liver.